Hello everyone, a very good evening to all of you. I hope I'm clearly visible, audible. Yes? So, this is the pharmacology session. From today, I'm starting the pharmacology sessions. So, in the pharmacology, we will be starting from the beginning. That is general pharmacology. So, without wasting time, I'm just starting the general pharmacology. So, before starting the two important chapters in general pharmacology, that is pharmacokinetics and pharmacodynamics, let me give you the overview what is pharmacokinetics and what is pharmacodynamics, right? So let me start the general pharmacology. We know what is pharmacology. Pharmacology is the branch that deals with drugs, right? So it is a branch, it is a science of the drugs. So humans have diseases. We have numerous diseases in human body we can have. To treat the diseases, we use drugs. So drugs are the substances which are used to treat the diseases. And the science of the drugs comes under the discipline that is pharmacology. In pharmacology, we are having two branches, pharmacokinetics and pharmacodynamics. You can see it here, pharmacokinetics and pharmacodynamics. Pharmacokinetics, you can see, and pharmacodynamics, you can see. Now, what is the difference between pharmacokinetics and pharmacodynamics? Let me tell you one by one with the help of a simplified diagram. Let me start with pharmacodynamics. Just suppose any person have any diseases. For example, I am having headache. For example, I am having just for say migraine headache. So what I will do? I will take some drug to treat my headache. I will take some medicine. The medicine is the drug, right? So most probably, most of the medicines, most convenient route, they are taken by oral route. So I'm taking a tablet or a capsule or a drug or a medicine by oral route to treat my headache. So what I'm assuming the drug will do? I'm assuming the drug will go inside my body. It will get absorbed. It will reach my cranial blood vessels and it will treat my headache, right? So what the drug is doing to the body is known as pharmacodynamics. Pharmacodynamics means what the drug doing to the body. Drug body पे क्या असर दिखा रही है? हिंदी में कहे तो ड्रग बॉडी पे क्या असर दिखा रही है उसे कहते हैं फार्माकोडायनेमिक्स. सो फार्माकोडायनेमिक्स इज द मैकेनिज्म ऑफ एक्शन ऑफ द ड्रग on the body. So I'm assuming whatever drug I am taking, it is showing its mechanism of action in the brain and treat my headache. So depending on the disease, the site of action can be different, right? And mechanism of action can be different. तो drug body पे क्या असर दिखा रही है उसे कहते हैं pharmacodynamics. D for drug, D for dynamics. Learn like that, you will never forget. तो dynamics का मतलब होता है drug body पे क्या क्या काम कर रही है, क्या असर दिखा रही है, उसे कहते हैं pharmacodynamics, right? So after pharmacodynamics come on pharmacokinetics. लेकिन drug directly do not reach the site of action and show its mechanism of action. Before that, what the body is doing to the drug, body drug के साथ क्या कर रही है उसे कहते हैं pharmacokinetics. सबसे पहले body will absorb the drug, absorb करके उसको blood में पहुंचाएंगे. So there are various routes. Mostly we take the drug by oral route, we take the drug by intramuscular route, we take by IV route, subcutaneous route, multiple routes are there. Ultimately सारी drug जाती हैं blood में. From all the routes, it is going in the blood. ठीक है, इसे कहते हैं absorption. So पहले तो drug blood में जाए, blood के बाद अपने site of action पे जाए. So first absorption, then distribution. Distribution के बाद होता है metabolism और फिर होता है excretion. Okay, let me explain you with the help of a simple diagram. Can you all see a diagram, a simple diagram? You can see a GIT, you can see the mouth, esophagus, stomach and intestine. This is GIT. ठीक है? You can see the blood vessel. ठीक है? This is the site of action, liver and kidney. Let me show you why I have drawn this diagram for you. Listen, this is the drug. Everyone have a look here. Please everyone see. For example, someone is taking the drug by mouth. If I am the person, I am having migraine headache, I am taking a tablet to treat my headache. So the tablet is going in the mouth. So drug is going in the mouth. From the mouth, it is going to the esophagus. ठीक है? From esophagus, it is going to the stomach and it is going to the intestine. Some drugs are absorbed from the stomach and some drugs are absorbed from the intestine. Ultimately, the drug is absorbed and reaches the blood vessel. So what is the definition of absorption? Can anyone tell me absorption का मतलब क्या हुआ? What is the definition of absorption? Absorption is movement or transport of drug from site of administration. This is administration. From site of administration to circulation. Site of administration is oral route. वहां से लेके blood में आई drug, इसे कहते हैं absorption. सो ड्रग इज एब्जॉर्ब. सो फर्स्ट थिंग, ड्रग को पहुंचना है ब्लड में. ड्रग को पहुंचना है ब्लड में. ब्लड में पहुंचने के लिए उसे होना पड़ेगा एब्जॉर्ब. सो दिस इज एब्जॉर्प्शन. व्हाट इज द डेफिनेशन ऑफ एब्जॉर्प्शन? मूवमेंट ऑफ ड्रग फ्रॉम व्हाट टू व्हाट, फ्रॉम साइट ऑफ एडमिनिस्ट्रेशन टू सर्कुलेशन. ठीक है, ऐसे कहते हैं एब्जॉर्प्शन. अब ड्रग पहुंच गई ब्लड में. ठीक है, ब्लड में से ये हर जगह जाएगी, लेकिन जहां इसके रिसेप्टर्स होंगे वहां सबसे ज्यादा जाएगी. सो इफ सम ड्रग इज हैविंग रिसेप्टर्स इन द ब्रेन, वो ब्रेन में जाके काम दिखाएगी. सम ड्रग हैव रिसेप्टर्स इन द इंटेस्टाइन, तो वो इंटेस्टाइन में जाएगी. डिपेंडिंग उसके रिसेप्टर्स कहां है, उसका साइट ऑफ एक्शन वो होगा. सो ड्रग विल मूव टू इट्स साइट ऑफ एक्शन. दिस इज नोन एज डिस्ट्रीब्यूशन. डिस्ट्रीब्यूशन. सो डिस्ट्रीब्यूशन इज द मूवमेंट ऑफ द ड्रग फ्रॉम द सर्कुलेशन टू द टिश्यू. डिफरेंट टिश्यूज में जा रही है, उसे कहेंगे डिस्ट्रीब्यूशन. तो सबसे पहले हुआ एब्जॉर्प्शन, उसके बाद हुआ डिस्ट्रीब्यूशन. दोनों का डेफिनेशन समझा. सबसे पहले आपने ओरल रूट से लिया, तो वो आपका साइट ऑफ एडमिनिस्ट्रेशन है. एडमिनिस्ट्रेशन से लेके सर्कुलेशन तक आना, दिस इज सर्कुलेशन. सर्कुलेशन इज द ब्लड. एडमिनिस्ट्रेशन से सर्कुलेशन तक आने को कहते हैं एब्जॉर्प्शन. और सर्कुलेशन में से टिश्यू में जाना, साइट ऑफ एक्शन पे जाना, उसे कहते हैं डिस्ट्रीब्यूशन. ठीक है, यहां पे जाके ड्रग अपना मैकेनिज्म ऑफ एक्शन दिखाएगी, जो भी उसका मैकेनिज्म ऑफ एक्शन है. सो दिस मैकेनिज्म ऑफ एक्शन आपका आ जाएगा फार्माकोडायनेमिक्स में. मैकेनिज्म ऑफ एक्शन, व्हाट द ड्रग इज डूइंग टू द बॉडी, ये आपका फार्माकोडायनेमिक्स में आएगा. ठीक है, मैं फिलहाल फार्माकोकाइनेटिक्स के 4 पार्ट्स बता रही हूं. पहला पार्ट है एब्जॉर्प्शन. बॉडी ने ड्रग को एब्जॉर्ब किया. ठीक है, बॉडी ने ड्रग को डिस्ट्रीब्यूट किया. ठीक है, अब ड्रग हैज ऑलरेडी शोन इट्स मैकेनिज्म ऑफ एक्शन. मैकेनिज्म ऑफ एक्शन हो गया ड्रग का, फार्माकोडायनेमिक्स हो गया. ड्रग ने हेडेक ठीक कर दिया, द हेडेक इज ट्रीटेड. ड्रग ने अपना काम कर दिया. अब ड्रग को जिंदगी भर तो हम ब्लड के अंदर नहीं रख के बैठेंगे, बॉडी के अंदर नहीं रख के बैठेंगे ना. द ड्रग कैन नॉट बी कैप्ट इन द बॉडी फॉर एवर. नो, इट कैन नॉट बी कैप्ट इन द बॉडी, इट हैज टू बी एक्सक्रीटेड आउट ऑफ द बॉडी. वंस इट्स जॉब इज डन, अब काम हो गया ड्रग का, तो उसको एक्सक्रीट करो बॉडी से. तो एक्सक्रीट करने के लिए ड्रग विल गो टू द किडनी. Most of the drugs are excreted in urine, right? So drug will go to the kidney for excretion, But most of the kidney में से कौन सी drug excrete होगी? The kidney will excrete only those drugs in urine which are water soluble. Because urine is water. We know urine is liquid. Urine is water. So the drug which is water soluble means the drug which is polar. Polar का मतलब होता है water soluble. Only that drug will be excreted from kidney. But the unfortunate thing is that most of the drugs are non-polar. Most of the drugs are non-polar. They are not polar. They are not water soluble. So we cannot directly do the excretion. So first the drug will go to the liver. First the drug will go to the liver and convert from non-polar to polar. Liver convert the non-polar drug to polar drug. Why liver is doing so? Water insoluble को water soluble बना रहा है, so that that drug can be easily excreted out of the kidney. This step is known as metabolism. Metabolism takes place in liver. So metabolism और biotransformation एक ही बात है. Metabolism और biotransformation one and the same thing. You got my point? Either you say metabolism or you say biotransformation. इसका मतलब एक ही होता है. It takes place in liver. Liver convert non-polar drug to polar drug. So once the drug get converted from non-polar to polar, that is water insoluble to water soluble, now drug can be easily go to the kidney and get excreted. So body 4 चीजें कर रही है. The body is doing 4 things to the drug. Number 1, body is first absorbing the drug, then body is distributing the drug, then body is doing the metabolism or biotransformation of the drug, and then body is doing excretion of the drug. These 4 things are done by the body on the drug. That's why these 4 things comes under pharmacokinetics. ड्रग इज डूइंग ओनली वन थिंग टू द बॉडी. बदले में ड्रग सिर्फ एक काम कर रही है, मैकेनिज्म ऑफ एक्शन. तो मैकेनिज्म ऑफ एक्शन आ जाएगा फार्माकोडायनेमिक्स में, और बची हुई 4 चीजें आ जाएंगी फार्माकोकाइनेटिक्स में. फार्माकोकाइनेटिक्स यानी बॉडी ड्रग के साथ क्या कर रही है. तो बॉडी सबसे पहले ड्रग को एब्जॉर्ब करेगी, फिर डिस्ट्रीब्यूट करेगी, फिर मेटाबॉलिज्म करेगी और फिर एक्सक्रीशन करेगी. तो ये 4 चीजें आती हैं फार्माकोकाइनेटिक्स में. चारों का डेफिनेशन बताओ. एब्जॉर्प्शन का मतलब क्या होता है? चलो मैं चारों का डेफिनेशन बोल रही हूं. एब्जॉर्प्शन इज मूवमेंट ऑफ द ड्रग from the site of administration till circulation. This is absorption. From circulation to tissue, this is known as distribution. Right? Conversion of non-polar drug to polar drug, which is done in liver, it is known as metabolism or biotransformation. And excretion of drug out of the body in the form of the urine, it is known as excretion. तो ये 4 parts हैं आपके pharmacokinetics के. So absorption is A, distribution is D, metabolism is M, and excretion is E. Make a mnemonic, ADME. So pharmacokinetics includes 4 things. ADME. एब्जॉर्प्शन, डिस्ट्रीब्यूशन, मेटाबॉलिज्म, एक्सक्रीशन, ये 4 चैप्टर्स हैं अलग अलग. मुझे चारों चैप्टर्स पढ़ाने हैं आपको एक एक करके, तो जाके पूरा फार्माकोकाइनेटिक्स कंप्लीट होगा, राइट. और फार्माकोडायनेमिक्स में सिर्फ एक ही चीज है, that is mechanism of action of the drug, the various mechanism of actions of the drug. I will teach you 5 type of receptors here, the 5 different mechanism of action. Give me a thumbs up. So that is the overview of the chapter. So you got my point. फिर से देखो. So what is pharmacology? Pharmacology is the study of the drug. Pharmacology is the study of the drug. It is having two branches, pharmacokinetics and dynamics. पहले मुझे बताओ pharmacodynamics क्या होता है? Dynamics, what the drug doing to the body. ड्रग बॉडी पे क्या करती है? सिर्फ एक चीज करती है, मैकेनिज्म ऑफ एक्शन. सो ड्रग इज शोइंग इट्स मैकेनिज्म ऑफ एक्शन, ठीक है. एंड व्हाट द बॉडी डूज टू द ड्रग, उसे कहते हैं फार्माकोकाइनेटिक्स. तो फार्माकोकाइनेटिक्स में देयर आर 4 थिंग्स: एब्जॉर्प्शन, डिस्ट्रीब्यूशन, बायो ट्रांसफॉर्मेशन ऑल्सो नोन एज मेटाबॉलिज्म, और एक्सक्रीशन, ADME. द निमोनिक इज ADME. So give me a thumbs up. We have understood it completely. You can see it is ADME. तो सबसे पहले ड्रग का होगा एब्जॉर्प्शन, ये हुआ एब्जॉर्प्शन, फिर होगा डिस्ट्रीब्यूशन, फिर होगा मेटाबॉलिज्म इन द लीवर, और फिर होगा एक्सक्रीशन. So you can see the same diagram from the KD Tripathi book, a very good book, a very good review book. You can see the same diagram here. What you can understand here in this diagram, you can understand this is the drug taken by any route, for example by oral route, So from oral route the drug is going to the blood. The drug is going to the blood, and this is known as absorption. This is known as absorption. Absorption is site of administration to the blood. From the blood, it is going to the site of action. अपनी site of action पे जा रहा है. That is in the tissue. This is known as distribution. ठीक है, distribution के बाद the drug is getting converted from non-polar to polar in the liver. That is metabolism. And in the end, it will be excreted. It will be excreted. It will be excreted in the urine basically, from the kidney. So these are the 4 parts. Now, have you got it? Have you got it? So what is the summary? So pharmacology have 2 branches, pharmacokinetics and pharmacodynamics. What do you mean by that? Pharmacokinetics means what the body is doing to the drug, and pharmacodynamics means what the drug, D for dynamic, D for drug, is doing to the body. ठीक है. So that is the definition given. Here body does 4 things to the drug. Body absorbs, distribute, metabolize and excrete the drug one by one. But drug does only one thing to the body. Drug shows its mechanism of action on the body. So pharmacokinetics have 4 chapters under it, and pharmacodynamics have only 1 chapter under it. So I would like to ask you 3 questions now. If you got this, you can easily answer them. Write your answer in the comment box right now. ठीक है, पहला क्वेश्चन सुनो, read the question and who will tell me the answer? So pharmacokinetics includes all of the following except. I am asking except. Pharmacokinetics में क्या नहीं आता है? Your options are in front of you. Absorption आता है कि नहीं आता है? Distribution आता है कि नहीं आता है? Adverse effects आते हैं कि नहीं आते हैं? और excretion आता है कि नहीं आता है? Pharmacokinetics में 4 चीजें आती हैं, क्या नहीं आता है? You tell me which do not come. So what is your answer? A, B, C or D? What is your answer? Pharmacokinetics doesn't include. The question contains except. Question number 1 का आंसर लिखो. This is question number 1. Write down the answer. I'm not telling you answer right now. You tell me what is your answer. You tell me. This is question number 2. Can you see question number 2? You tell me pharmacodynamics includes what? Pharmacodynamics में क्या आता है? Drug का elimination, drug का excretion, drug का absorption या drug का mechanism of action? क्या आता है? Pharmacodynamics में क्या आता है? चारों में से. What is pharmacodynamics? D for what? I've told you very clearly. तो चारों में से आंसर A है कि B है कि C है कि D है? So this is answer of question number 2. Question number 2 का आंसर please write down. I'm giving you adequate time to understand the question and write down in the comment box. Please write down your answer in the comment box, please. And this is the last question number 3 based on this. So this is the question number 3. What is the question? Again, pharmacodynamics deals with what? It is the effect of drug on the body or effect of body on drug. Is it absorption of drug or metabolism of drug? What do you say? तो क्या आंसर होगा? Effect of drug on body कि body on drug? ड्रग बॉडी पे क्या कर रही है कि बॉडी ड्रग पे क्या कर रहा है? किसे कहते हैं? फार्माकोडायनेमिक्स क्या है? सो व्हाट इज योर आंसर? ए, बी, सी और डी? व्हाट इज योर आंसर? That is question number 3. Question number 3 का आंसर बताओ. So tell me the 3 questions. The 3 questions, the 3 answers. So I want peculiar, तीनों का अलग अलग आंसर. Question number 1, answer is this. Question number 2, answer is this. Question number 3, answer is this. Please write down. I want to see तुम्हें समझ में आया कि नहीं concept. ठीक है. So with this, I would like to start with pharmacokinetics. Kinetics. The first, we will study pharmacokinetics, and after finishing it, there are 4 chapters. I will start with the first chapter, absorption. Then I will move on distribution. I will move on metabolism, and the most important and difficult to understand is excretion, जिस पे multiple numericals आते हैं. We will solve numericals also. Don't worry. Let me start the first chapter, absorption. Shall I start the first chapter, absorption? So ये चारों चैप्टर होने के बाद we will come on pharmacodynamics. ठीक है, we will study everything. Don't worry. So let me start with pharmacokinetics. As I have already told you the definition of pharmacokinetics. I've already told you the definition of pharmacokinetics. What does pharmacokinetics means? It is the drug needs to reach at the site of action. Appropriate concentration, safe and effective. Okay. So it is the study of movement of the drug through and out of the body. Right. So it is what the body is doing to the drug. So basically it is having 4 chapters. We already know ADME. ADME. Let me start the first chapter, absorption. ठीक है, you already know what is absorption. Absorption is movement of the drug from the site of administration till circulation. It got absorbed. That is this movement is known as absorption. You already know that. You already know that. So let me continue with drug absorption. Chapter number 1, drug absorption. It is movement of the drug from where to where, from site of administration till circulation. Right? So this is the definition of absorption. Let me teach you. Absorption पे सिर्फ 2 क्वेश्चन आएंगे. Absorption पे आपको सिर्फ 2 चीजें पढ़नी है. What 2 things you have to study in absorption? So you should know the first chapter, absorption. I'm teaching you the first chapter of pharmacokinetics. We have started pharmacokinetics. The first chapter is absorption. ठीक है. Absorption में आपको एक तो इसकी definition आना चाहिए, दूसरा factors affecting absorption आना चाहिए. There are 9 factors. You should be able to explain all. ठीक है. And bioavailability का concept आना चाहिए. What is bioavailability? It is related to absorption. इन तीनों पे आपके यूनिवर्सिटी एग्जाम में questions can come. Definition you already know. It is the movement of the drug from the site of administration till circulation. Now coming on the factors affecting absorption. ठीक है. So coming on the factors affecting absorption, there are 9 factors affecting absorption. The 9 factors are in front of you. These are the 9 factors which affect absorption from the GIT. Most common route is GIT only for most of the drugs. The oral route is preferred. ठीक है. तो GIT में ये 9 factors हैं. इनमें सबसे difficult understanding is the pH. I will teach you pH का पूरा numericals आते हैं इस पे बहुत सारे. I will teach you the complete derivation कैसे pH का effect होगा. Acidic drugs पे क्या होगा, basic drugs पे क्या होगा. So pH हम end में लेंगे. उसके पहले छोटे छोटे बहुत सारे factors हैं. The factors which affect the absorption of the drug from the GIT. So let me enumerate them one by one. We will be talking about them one by one. The first is the aqueous solubility. So you can see now drugs के syrups भी आते हैं, tablets भी आती हैं, capsule भी आते हैं. Tablets, capsules, syrups, drugs come in multiple forms, right? So what do you think? The same formula, the same composition available in multiple forms. So which is rapidly absorbed? Is it a tablet or a capsule or a syrup? Yes. So does it depends? Does it depends on the state of physical state, whether it is solid or liquid? Yes. So aqueous solutions are rapidly absorbed. Solutions are rapidly absorbed as compared to solid forms. So I can say syrups are more rapidly absorbed as compared to tablets or capsule. So tablet or capsule से ज़्यादा easily syrup के form में drug absorb होगी. Right? That's why to children we directly give to the syrups. Right? Because solutions are rapidly absorbed. And whatever tablets we are taking either with the water or some liquid only. So the tablet will get dissolved in that particular liquid after going in the stomach. So again, वो भी solution ही बनाएगी. लेकिन if you are taking directly solution, so that is rapidly absorbed. So the first factor is the aqueous solubility. Aqueous solubility. Give me a thumbs up. So you can see this is a tablet. The tablet get dissolved into multiple granules and it will get dissolved in the water. ठीक है? So the first factor is aqueous solubility. More is the aqueous solubility of the drug, more is the absorption. So can I say absorption is directly proportional to aqueous solubility? The first factor is aqueous solubility. More is the aqueous solubility, more is the absorption. ठीक है, वी आर हैविंग टू ड्रग, ड्रग ए ड्रग बी, एक की एक्वस सॉल्युबिलिटी ज्यादा है, एक की कम है, तो एब्जॉर्प्शन ऑफ दैट, द वन विच इज हैविंग मोर एक्वस सॉल्युबिलिटी विल बी मोर एज कंपेयर टू अदर, जिसका कम है एक्वस सॉल्युबिलिटी. द सेकेंड इज द फॉर्मुलेशन. यू नो ड्रग्स कम्स इन द फॉर्म ऑफ मल्टीपल टैबलेट्स, कैप्सूल्स, एज आई हैव टोल्ड यू. ठीक है, तो उसमें बहुत सारे इनर्ट सब्सटेंसेस भी होते हैं अपार्ट फ्रॉम द एक्टिव केमिकल कंपोजिशन ऑफ द ड्रग. फॉर एग्जाम्पल द ड्रग इज पैरासिटामोल, तो पैरासिटामोल का एक टैबलेट आता है, उस टैबलेट में पैरासिटामोल तो होगा, द एक्टिव ड्रग जो मेन ड्रग है. उसके अलावा सम इनर्ट सब्सटेंसेस आर देयर लाइक स्टार्च, लाइक कैल्शियम, लैक्टेट, सुक्रोज, लैक्टोज, ये सब पैकिंग के लिए, कंपोजिशन के लिए रिक्वायर्ड है. दैट आल्सो अफेक्ट द एब्जॉर्प्शन. समटाइम दे कैन इंक्रीज, दे कैन डिक्रीज, right? So the formulation में जो other inert substances हैं, they can increase absorption, they can decrease absorption, they affect the absorption of the main drug. तो टैबलेट में एक तो पैरासिटामोल है, पैरासिटामोल के अलावा जो पैक करने के लिए, टैबलेट को कॉम्पैक्ट करने के लिए जो सब्सटेंसेस हैं, वो बढ़ा भी सकते हैं एब्जॉर्प्शन, उसका कम भी कर सकते हैं. ठीक है, सो दैट वी कैन नॉट कमेंट. द थर्ड इज द कंसंट्रेशन ऑफ द ड्रग. So more is the concentration of the drug, rapid is the absorption. Rapid is the absorption. So whenever, just suppose you are taking a tablet, just suppose I am having fever, I am having fever, and for that I am taking the tablet paracetamol. So shall I take paracetamol with few sips of water, or shall I drink complete glass of water? ज्यादा absorption fast कब होगा? So whatever paracetamol tablet I am taking with water, that is going inside my stomach, and in the stomach it is converting into solution. So if I take with few sips, 4-5 sips of water, it will form a concentrated solution in my stomach. And if I drink 2-3 glass of water, so it will form a dilute solution in my stomach. So dilute solution है तो absorption में time लगेगा, concentrated solution है तो absorption fast होगा. You got my point? So the concentration is directly proportional to the rate of absorption. जितना concentrated solution है, the rate of absorption will be faster. So concentration is directly proportional to absorption. Aqueous solubility is directly proportional to absorption. Formulation can increase or decrease the absorption, right? The next is the lipid solubility. Some drugs are more lipid soluble, some are less lipid soluble. So lipid solubility affects absorption. More is the lipid solubility of the drug, faster is the absorption. Just suppose I am having two drugs, drug A, drug B. Drug A की lipid solubility is more and drug B की lipid solubility is less. So drug A will be faster absorbed as compared to drug B. So lipid solubility is directly proportional, because you know lipid cell membranes are made up of, you know, this yellow color cell membrane. The cell membrane is made up of lipid. You know, cell membrane is made up of bilayer of the lipid. So just suppose this is the drug present in the stomach, in the lumen of the stomach. So for getting absorbed, it has to cross the cell membrane. You got my point, what I am saying? Listen, I want to say you this. So let me draw the esophagus, let me draw the stomach, and let me draw the intestine. We will understand everything with the basic, right? And let me draw a few cells. ठीक है, let me change the color. Okay, so these are the cells of the stomach. ठीक है, and these are the cells of the intestine. Let me draw a few cells here also, here also. So this is the mucosa. This is the mucosa. Mucosa के पीछे होती है submucosa. In the submucosa, blood vessels are present. Let me draw a blood vessel. So this is a blood vessel. I am drawing a blood vessel. This is the blood vessel present in the submucosa. This is the blood vessel. ठीक है? This is the lumen of the blood vessel. You can appreciate I am marking the lumen. ठीक है? Where is the drug? Where is the drug? This is the drug. Let me draw the drug with another color. So you are taking a drug by mouth. The drug is going in esophagus. The drug is going in stomach. And the drug is going in intestine. Now I want this to get absorbed. The drug will absorb. It will reach in the blood here. The drug is absorbed and it will reach in the blood here. Drug can be absorbed from the stomach and drug can be absorbed from the intestine, depending drug is acidic or basic. ये वाला factor हम pH में consider करेंगे कि कौन सी drug कहाँ से absorb होती है, acidic drug कहाँ से absorb होती है, basic कहाँ से होती है, मैं सब बताऊंगी. Don't worry. My point here is that you can see drug while crossing, it has to cross the cell. कैसे जाएगा blood में? Directly jump करके नहीं जाएगा. So drug first go inside this cell. इस cell के अंदर जाएगा. एंड उसके बाद ब्लड में जाएगा. यहां पे भी ड्रग इस सेल के अंदर जाएगा, इंटेस्टाइनल सेल, और फिर यहां जाएगा. तो सेल की जो सेल मेम्ब्रेन है वो बनी है लिपिड की. सेल की सेल मेम्ब्रेन काय की बनी है? लिपिड की. अब इमेजिन करो ये ड्रग भी लिपिड सॉल्यूबल है तो ये इजीली इस सेल को क्रॉस करेगा. अगर ड्रग लिपिड इनसॉल्यूबल है तो these cells cannot be crossed by the drug and drug will remain in the lumen only and it will get excreted in the feces. You got my point? So lipid soluble drugs will cross the cell. Which cell? Either stomach ka cell, gastric cell or intestinal cell, and it will go in the blood. Lipid soluble. लेकिन lipid insoluble है तो it cannot cross the cell, it cannot go in the blood, it will remain in the lumen only, and it will finally excreted in the stools in the feces. You got my point? So that is the relevance of lipid solubility. I guess everyone got it. If everyone got it, give me a thumbs up if you got the meaning of the lipid solubility. So more is the lipid soluble is the drug, faster is the absorption. So lipid solubility is the next factor. You already got it. So lipid solubility also directly proportional to the absorption. Coming on the next point, surface area of absorption. You know why God has given us villi in the intestine? Intestine can be smooth from inside. Now, God has not given us smooth intestine. The lumen of the intestine, can you see? This is the lumen of the intestine. It is thrown in multiple folds. These are known as villi. And on the villi, we are having microvilli. You got my point? What I mean to say? I mean to say this. So this is the intestine. This is the human intestine. Let me draw a small segment. So it is not smooth from inside. If you see from inside, there are multiple folds. The folds are villi. And on the villi also, there are small microvilli. Why God has given like this? Why we are having villi and microvilli? To increase the surface area. You got my point? The surface area is more. So if this is the drug, it is moving inside. So if it was plain, it was smooth, you can see this side. So surface area is only like this. But now the surface area is like this. So to increase, more is the, so this drug will come in contact with all the surface area to get absorbed. So more is the surface area, more is the absorption. So that is the relevance of the villi. So surface area is directly proportional. You can see villi and microvilli. To increase the surface area, we are having villi and microvilli in the intestine. So the surface area is directly proportional to absorption. Okay. The next is the motility of the GIT. In the GIT, we are having a thing known as peristalsis. You know, peristalsis. Peristalsis is a wave in which constantly the food is moving here and there because of that wave. Can you see here? I have drawn a segment of the intestine or the GIT, you can say. So this is the segment of the GIT. Constantly a wave is traveling, contraction, relaxation, alternate contraction, relaxation. So food is moving, shaking inside and coming in contact, more contact with the surface. So the motility, a little motility increases the absorption. So more is the peristalsis, more is the motility, more will be the absorption. Again, this is directly proportional. Coming on the next point, presence of other substances in the GIT. For example, this is the stomach and it contains the drug A. I want this drug A to get absorbed and reach here in the blood. After absorbing, it reach here in the blood. But along with drug, food is also present in the stomach. In the stomach, food is also present. So food will increase the absorption or decrease the absorption. So now these are the cells. These are the cells of the stomach and intestine. The cells of the stomach and intestine, they have to absorb both. They have to absorb drug also. They have to absorb food also. So of course, food will interfere and decrease the absorption. That's why if you want faster absorption, the drug should be taken empty stomach. You ask your patient to take the drug empty stomach if they want faster absorption. If they food, after food, they take the drug. Now, whenever you are a doctor, ना, आप किसी भी patient को drug लिखोगे तो पहला question patient पूछेगा डॉक्टर साहब खाने से पहले लेनी है कि खाने के बाद कब लेना है drug? ये question हमेशा अक्सर patient पूछते हैं. Most of the time patient asks this question to you. So you should be able to answer. कुछ drugs ऐसी होती हैं that irritate the gastric mucosa and they produce acidity and gastric burning, gastric irritation. वो drugs को आप patient को कहोगे to take after food. Otherwise, if take after food, तो absorption तो delay होगा. Absorption तो delay होगा. If you want faster absorption, drug should be taken empty stomach. But to avoid this side effect, we cannot ask all the drugs to take empty stomach. Right? So other food affects the absorption. Other things affects the absorption. Okay? The next is the vascularity of the absorbing surface. You know blood flow of the GIT. Blood flow of the GIT is the mesenteric blood vessels. You already know superior mesenteric, inferior mesenteric artery. So we want the drug to get absorbed in the blood vessel. Can you see? This is the blood vessel, the mesenteric. So more is the blood flow, faster will be the absorption. Right? So that is the vascularity. Now सिर्फ एक factor बचा ionizing जो मैं next session में लूंगी. ये बहुत important है pH. ये सबके समझने के बस का नहीं है. I'm warning you, the pH is the most difficult portion. Acidic drugs का absorption, acidic drug का excretion, basic drug का absorption, basic drug का excretion. चार चीजें मैं समझाऊंगी next session में, that is effect of pH on acidic and basic drug. Right? Till now we have covered the eight factors. Can you enumerate the 8 factors? So these are the factors of absorption. Aqueous solubility directly proportional to absorption. Formulation can increase or decrease the rate of absorption. Concentration also directly proportional to absorption. Lipid solubility also directly proportional to absorption. Surface area also directly proportional. Motility also directly proportional. Vascularity also directly proportional. Other substances can increase or decrease the rate of absorption. So that is the summary. That is the summary. But the most important is the pH that we will consider in the next session. I hope you have learned a lot in this session. If you have any doubt, even a slightest doubt in your patho, pharma, micro, anything, please feel free to ask your doubt to me on this contact number. So this is my contact number. It's 9833032948. Please distribute this number, everyone, to all the medicos you know in your contacts, so they can ask your doubt in patho, pharma, micro, PSM or medicine to me directly. And whenever I will get time, I will definitely revert back to you. So thank you very much. And yeah, once before ending this session, a small motivation as usual. I always give you a small motivational quote before leaving the session, right? So what is the today's motivational quote that will give you a motivation from inside that we have to study? क्या है आज का quote? Imagine you are coming out of ICU, telling someone that their loved one is safe and out of danger. Please imagine that you are coming out of ICU and people are asking you, what happened, doctor? And you are saying someone that don't worry, your loved one is safe and it is out of danger. वो जो feeling है ना, उसको imagine करके देखो. Not try it out. Just imagine and just say it out. Just say it to someone. Just say it. So for saying, no, not everyone is privileged to say this line. Only doctors, you know, the doctors are privileged to say this line. So ये privilege तुम्हें मिला है. You are getting this privilege, right? So people are waiting outside the ICU when the doctor will come. People are waiting outside the OT and they are waiting when the doctor will come, when the surgeon will come, when the treating physician will come, and they will let us know what happened to our loved ones. So the life of the loved ones of the people is in your hands. You are God. You are next to God. Not exactly God, I must say, but you are next to God. People consider you next to God when their beloved one, when their loved one life is in your hands. And you should make yourself इतना eligible कि तुम्हें God का दर्जा दिया जा सके, तुम्हें God के equivalent माना जा सके, और तुम बाहर आके लोगों को ये कह पाओ कि don't worry, तुम्हारे loved ones safe हैं, out of danger हैं, your daughter, your son, your spouse, your mother, your father, your friend, he or she is safe and out of danger. Don't worry, I am your doctor. Trust me, I will take care. ये बोलने के लिए बहुत हिम्मत चाहिए, बहुत गट्स चाहिए, और यहां तक पहुंचने के लिए बहुत हार्ड वर्क चाहिए, जो तुम्हें करना है और तुम करोगे. You will do it. You will do. I know you will do it. You are eligible and you will do it. You will do it. One day you will say this line to your patients, to family of your patients, right? So thank you very much. Bye-bye. And if you like the lecture, don't forget to click on the like button before leaving. Share the link on your batch groups. I don't know why you are not sharing the links on your batch groups. I guess most of the students are second prof now. I request you to share the link of this lecture or YouTube channel on your batch group and ask your batchmates to join it once, to watch any of the recording and join it once. At least once. एक बार तो देखना बनता है. उसके बाद पसंद आए ना आए, it's their choice. ठीक है? Don't forget to subscribe our YouTube channel and press the bell icon for getting notifications. So thank you. Bye-bye. Study hard. I'm ending this session.